Welcome, future nurses. Today we are tackling something you're going to be doing all the time, giving meds through a Central Venous Access Device, or a CVAD. Seriously, this is one of those skills that's absolutely fundamental. Getting this right isn't just about passing your tests, it's about keeping every single one of your future patients safe. So let's jump right in.
So why are we focusing so hard on this one skill? Well, check this out. Medication administration can eat up a whopping 40% of your time as a nurse. Let that sink in. 40%. So yeah, mastering this isn't just about acing an exam. It's about becoming a pro at a massive part of your day-to-day job.
Okay, first up, let's do a super quick review. What exactly is a CVAD? Think of it as a special IV line that goes into a big central vein. Why do we use them? Well, it's perfect for when you need meds to work right away or for long-term treatments like heavy-duty antibiotics or chemo. It's basically a direct highway for some really powerful, life-saving stuff.
So, to make sure you walk away from this feeling confident, we've broken the whole procedure down into 6 easy-to-follow parts. We're going to start with the absolute basics, the safety checks, then walk through the procedure step by step. We'll even cover what to do when things go wrong and wrap it all up with how to document everything properly. Sound good?
Okay, let's get started with Section 1, the foundation. I want you to think of these as your absolute must-do, non-negotiables. These are the checks you do before you even think about grabbing your supplies. All right, so there are 3 big ones here. Number 1, allergies. You have to check for allergies. This can literally save a life. Number 2, client ID. We're talking 2 different identifiers every single time, no exceptions. And number 3, standard precautions. That's for you and for your patient. It's all about preventing infection. All right, so with that foundation in place, let's move on to Section 2, your safety checklist. Now we're going to build on what we just talked about. We'll get into the famous rights of med admin and make sure we've got all the right gear lined up. Okay, you've probably heard of these before, but the 6 rights are going to be your absolute mantra as a nurse. We're talking right client, right medication, right dose, right route, right time, and right documentation. You're going to live and breathe this list. Seriously, it's not just about ticking boxes. It's the critical thinking that stops med errors in their tracks. And listen, getting these rights down cold is a total game changer, not just for your exams, but for your confidence when you're out on the floor. And hey, if this breakdown is helping you study, it would be awesome if you hit that subscribe button. We've got a lot more nursing explainers just like this one coming your way. Okay, next up, let's get our gear together. You'll need your gloves and PPE, the client's MAR, the medication itself, antiseptic swabs, and here's a super important pro tip: 10 milliliter syringes for flushing. Now, why a 10 milliliter specifically? It seems kind of random, right? Well, it's all about physics. A bigger syringe actually puts less pressure on the catheter. Using a smaller one could actually damage the line. So 10 milliliters is the rule. It's a huge safety thing. Okay, safety checks are done. Our equipment is all set. Now it's time for Section 3, preparing the patient. This is where all that technical skills starts to blend with that all-important human connection. So before you even walk into the room, you're going to review their chart and the MAR. Then, once you're there, provide privacy, introduce yourself, wash your hands. And notice what's next. We are verifying their ID and allergies again. Yep, you're doing it twice. That redundancy is your friend. It's a critical safety net. Last but not least, talk to your patient. Let them know what you're giving them and why. A patient who knows what's going on is way more likely to be calm and work with you. All right, here we go. We're at the bedside. Gloves are on. Welcome to Section 4, the administration procedure. Let's walk through this step by step.
Okay, first things first, you're going to use your eyes. Assess that CVAD site. Are you seeing any redness, swelling, or does the patient mention any pain? Next, and I cannot stress this enough, you need to scrub the hub. Take your antiseptic swab and scrub that little injection port for a solid 10 to 15 seconds. Be vigorous. This one little step is your best weapon against a nasty CLA-BSI, a central line-associated bloodstream infection. Once it's clean, attach your saline syringe, unclamp, and gently pull back. You're looking for blood return. Seeing that blood tells you, yes, we're in the right place, the line is patent.
Now, I want to pause here for a second because this is so important. Whatever you do, do not flush with force. If you feel any kind of resistance, you stop. That's it. Stop. If you try to force it, you could dislodge a blood clot, a thrombus, and send it flying into your patient's circulation. And that can be absolutely catastrophic. So remember, gentle and steady pressure. Always.
Okay, once you've confirmed that patency, go ahead and gently flush the line with saline. Then, guess what? You're scrubbing that port again for 10 to 15 seconds before you connect the medication. Administer the med at the rate it was ordered. After that, it's time to flush again, usually with at least 10 or 20 milliliters of saline to get everything through. Now here comes a really key piece of technique. For the very last bit of that final flush, you're going to start clamping the line while you are still pushing the plunger. This creates something called positive pressure, and what it does is it prevents blood from sneaking back into the tip of the catheter, which could cause a clot. It's a tiny little move, but it makes a world of difference. So, what happens when things don't go perfectly? It's going to happen. That's what Section 5 is all about, when things go wrong. Look, knowing how to handle complications is what makes you a truly great nurse. So let's break down the big three. First, occlusion. That's when you feel that resistance we talked about and you can't get any blood return. First, check for any obvious kinks in the line. If that's not it, you need to notify the provider. Second, a CLA-BSI. You're going to be looking for signs of infection, right? So, fever, chills, maybe a change in their mental status. Again, notify the provider. And third, the really scary one, a pulmonary embolism. The big red flags here are sudden shortness of breath, that's dyspnea, wheezing, or sudden anxiety. For any of these, your immediate action is the same. Stop and get the provider on the line, immediately.
Okay, we've given the medication, we know what to do if there's a problem. Now for the last part, Section 6, finishing up and documenting. Just remember, you're not done until you've cleaned up, documented, and made sure your patient is safe.
These final actions are just as critical as everything else we've done. You're going to get rid of all your waste, especially those sharps. Then, take off your PPE and wash your hands one last time. And before you walk out that door, you do a final safety scan. Is the bed low? Are the brakes locked? Is the call light right where they can reach it? Perfect.
And now we get to the golden rule of nursing, something you'll hear a million times. If you didn't chart it, it didn't happen. Your documentation has to be on point. You need the date and time, all the details of the med, dose, and route, what you found in your pre-assessment, and, this is huge, how the client responded. And of course, if something went wrong, you document exactly what happened and who you told about it.
And that kind of brings me to a final thought for you. The chart, it captures the science, right? The tasks you performed. But your actions, your words, the way you made that patient feel, that's how you document your compassion. So, the question I want to leave you with is this. Beyond that chart, how are you going to show that you truly care?
I really hope this explainer helped clear things up for you. If it did, it would mean a lot if you'd hit the like button, maybe share it with some friends from your class, and definitely subscribe so you don't miss our next video. We're all about creating content to help you crush it in nursing school.
And hey, one last thing, if you're really serious about acing your exams, make sure you check out the links down in the description. We put together some awesome summarized NCLEX revision books for all your courses to really give you that extra edge. Thanks so much for watching, and we'll catch you in the next one.